Yesterday, Elections BC completed the final count from the October 24th election, and the results have confirmed that British Columbians have chosen our NDP team to keep BC moving forward together. We have a strong mandate to make sure that we get through this pandemic safely and effectively, and that's going to be our commitment going forward. It's humbling to have the support of 48% of British Columbians. It's humbling to have the prospect of having 56 colleagues join me here in the legislature. Yesterday, I spoke with Lieutenant Governor Janet Austin. She has asked me to form a new government, and we're in the process of going through that transition, and we'll be announcing a new cabinet and a new government in the days and weeks ahead. In the last 2 weeks, we've seen a dangerous increase in COVID-19 cases, particularly in the Lower Mainland. And we need to make sure that we keep essential services functioning, surgeries, schools, and others operating as safely as possible. All of this is at jeopardy if we don't continue to focus on working together, each other, taking our responsibility to bring the case numbers down. We need to have targeted action. Dr. Henry has announced that over the past couple of days, and she'll be available later this afternoon to talk about those in detail. But over the next 2 weeks, we need to reduce our social contacts, and we need to make sure that we're staying local and reducing to only essential travel. We need to make sure that indoor physical activities are under a new safety plan. That means reinvigorating the work that's already been done with Public Health and WorkSafe BC to make sure we're narrowing in and following the science on these important questions. Our objective is to make sure that workplaces can be safe. Our objective is to make sure that our economy can remain open. But if you're sick, you need to stay home. If you don't know people that are gathering with you, you need to find another way to gather. These are really critical issues. Dr. Henry's made it abundantly clear. If we're going to get through this, we have to follow these basic directions. And with respect to workplaces, again, we need to follow the science. It's clear that we've seen significant outbreaks in Fraser Health and in Coastal Health in the Lower Mainland. But we've also had cases in Interior Health, cases in Northern Health, cases on Vancouver Island. But focusing on this regional approach, I believe, allows us to refine the practices that we put in place and make sure they're appropriate for where we are in the pandemic today, coming into what is clearly a second wave as we look at influenza season and the winter break that's coming. So we need to make sure that we're transferring more inspectors to public health, and we will do that. We need to make sure that WorkSafe is focused not just on employee safety, but patron safety as well. And we need to create ways to ensure that we are reducing risky behavior, reducing workplaces that have risky behavior, and we do that through, I believe, through hoping for compliance rather than rigorous enforcement. But enforcement is key and a vital part of the work that we will be doing in the weeks ahead. I also want to just take a moment to talk about our school system. It is important for kids, it is important for community that our school system remain open, and we have not seen any serious transmissions in our system since we reopened in September. But we need to be vigilant, particularly when case counts start to spike as they have. Bringing COVID-19 into our schools is something that we all need to guard against. That includes parents, that includes teachers, that includes support workers as well as administrators. And I understand that the Labour Relations Board will be making recommendations on putting in place a new troubleshooting process within our K-12 system. I'm very excited about that. It has my full support so that we can bring the stakeholders together on a more regular basis to target any challenges that we may see and work on resolving them as quickly as we possibly can. With respect to testing, you'll be aware, Minister Dix and Dr. Henry have been talking about this a lot. We are on track to get our capacity up to 20,000 tests per day in November, and we're going to continue to streamline our processes so that those tests can come back as quickly as possible and the delays are as little as they can possibly be. We're also going to be using the tools of government to amplify Dr. Henry's message through online and TV advertising, information being made available in multiple languages, as well as using social media to connect with those who don't watch the news or read the daily papers. That's going to be the route to our success, working together. Minister Dix and I and others have been talking with leaders in communities throughout the Lower Mainland to make sure that we're all on the same page. If we're going to get back to our envied position at the start of this pandemic, we need to ensure that we're all working on this together. The challenges are grave and they're significant, but I'm confident that if we focus on each other and focus on our communities, we'll come through this stronger than we went into it. Happy to take any questions anyone may have. Thank you.
Good afternoon, everyone.
New jacket.
Thank you for joining us today. We'll have questions. If media have questions, please hit *1 to get in the queue. To start things off, we have Binder Sajan from CTV. Binder, please go ahead.
Hi, Premier. I just wanted to kind of go back to what you were talking about there, that schools and businesses could be impacted if people don't start or don't abide by these new regional requirements here. And I'm just wondering if you talk a little bit more about what potentially is at stake. Would it be returning to stage 1 restrictions, which essentially was a lockdown?
Yeah, that's the end result if we don't start to see these numbers come down. We have had success in the past using influence within communities, talking to people about how they should behave, reducing the number of faces and making sure that we have larger spaces for gatherings. But as we come into the winter and the rainy season and in the south and of course snow and cold in other parts of British Columbia, we're going to find ourselves going indoors more frequently. And that's where we really have to guard each other. And our focus is to make sure that we keep our economy open and keep it functioning safely. We believe we can do that, and we're redirecting resources within government. We're going to make sure that inspections, for example, by WorkSafe are not just about I'll use restaurants as an example, not just about the restaurant and the staff within the restaurant, it's also about the patrons that are frequenting that restaurant. We need to make sure that everyone is safe, and that means pairing up public health officials with WorkSafe inspectors and other inspectors that are available to us, whether they be bylaw officers in communities or others. And that's how we're going to drive the curve down again. And we want to do that by keeping the economy open to the greatest extent possible, but it is going to require people to get with the program. And there's a whole bunch of people that are not abiding by the minimalist rules we had in place, and that's why we've seen the regional issues that Dr. Henry brought forward this week, and she'll be able to expand on those later today.
Binder, follow-up?
Yes, just on that note, I know that there was a directive for public sector employees to go back to work part-time. I understand that's not happening now in the metro region. Just wondering, what's your perspective on that? Do you think that policy was maybe came out too quickly?
Well, we're following the science. When we made the directive to bring people back to government workers back to their workplaces, it was done at a time when cases were relatively low. And on Vancouver Island, for example, cases are still low. But we'll be directed by the science what the evidence is that Dr. Henry receives and then how she presents it to us. But we are certainly very flexible on these issues, as we have to be. I don't think that British Columbians want us to hold rigidly to positions that have been proven to be inaccurate based on the evidence that's before us. And currently we're slowing down the return to the workplace, certainly in the areas where the orders are affecting people. But we're going to keep watching that and monitoring it on a regular basis. We need to make sure everybody's safe, but we also need to make sure all the work's being done. And we've been very successful working remotely and using technologies to bring people together. We're going to keep doing that until the science tells us otherwise.